Thank you for joining us on this program. The focus of this program is going to be around HIPAA, and it's a little bit different. We are casting a rather wide net here. So some of this information will be rather basic, but some of it is going to hope to give you some insights into managing and adopting HIPAA to your organization and understanding some of the intricacies and the gray areas, and hopefully bring clarity to that. So there's a lot here, whether you're just starting with HIPAA or you're a very seasoned compliance officer, CISO, or auditor. And so the other thing is we hope to make this fun and give you some insights that you may have not heard before. This program is sponsored by Sensato, and we'll talk a little bit more about ourselves and our Cybersecurity Tactical Training Center. But the focus on this program is really around education. So we highly suggest that you take notes. There's going to be a lot we cover here, and we're going to go into some depth and also give you strategies and tactics that you can employ. So with that, let's go ahead and get started and talk a little bit about Sensato very briefly. We were founded in 2013. We've been named twice top 500 cybersecurity, most innovative cybersecurity firm in the world. We are very NIST 853 focused, and we'll certainly touch on that in this presentation. We've done a variety of things. We sponsor a seminar every year called Hacking Healthcare. You can learn more about that at hackinghealthcare.net. We also are the founders of the Medical Device Cybersecurity Task Force, so we work a lot in the area of medical device security. And you know, we'll go deeper into some of our offerings later on, but for right now, really want to get into the heart of this presentation and get started. So first, before we do get too deep into this, I want to give you a disclaimer, and this is to protect both of us. You know, you can read the disclaimer on the left if you like, but it really comes down to 4 points. The first is that this is not legal advice. We are not attorneys, and so this presentation is for informational purposes only. Things change, whether in the regulatory landscape or elsewhere. So you need to seek proper counsel and guidance before you apply any of the information here, because we don't warranty this, and we're certainly not providing you with concrete recommendations, but rather things that you should research and validate to assure that they are accurate and that they fit within the complexities and challenges and unique situation that your organization represents. So with that said, let's go ahead and get into this kind of world of regulatory compliance and do a brief introduction. So I'm sure that most of you, if not all of you listening to this, understand that there are a variety of different regulations and legal requirements that touch on data privacy and security. And they're both at the federal level, the international level, and certainly at the state level, and in some cases even the county or local level. Not to mention things like your immediate best practices and goals and objectives within your specific organization. So the thing about all of this, though, is that when we think about it, really, you know, no matter how you dice this, under the covers is NIST 853. Now, for those of you that aren't familiar with NIST 853, you can look it up online. It's a free cybersecurity privacy framework. Now, we're speaking specifically here about HIPAA, and I can assure you that HIPAA is based on 853. Now, it doesn't matter if you go do HITRUST or if you want to use somebody else's approach. It's nothing wrong with those things. But under the covers, everything is 853. The most important thing to keep in mind is that, well, I guess there's two things. One is it's free. You can get all of the controls and workbooks and everything you need to do an 853 assessment on your own. And certainly HIPAA allows you to do a self-assessment. But the second thing is that if you get audited, specifically for HIPAA, if you have a privacy or security violation under HIPAA, the Office of Civil Rights, OCR, who's basically the HIPAA police, if you will, they're the ones enforcing HIPAA regulations and compliance, they will use 853 as the litmus, right? So regardless of what you use or how much money you spend on whatever framework, at the end of the day, if you're going to have a breach, you're more than likely going to be evaluated against 853. Now that's on the government side. The other thing to keep in mind is if you ever get sued on a privacy or security violation, we'll talk more about lawsuits in a minute, or you have cybersecurity liability insurance, chances are that in those situations, either the insurer looking at to determine how they're going to pay out and whether you were at fault or not and how much they have to pay, or if you were brought into some form of a class action lawsuit, the chances are very high that all of those entities, insurance, civil suits, as well as regulators, all are using 853. So it's really important that you understand that. And again, I'm not saying you shouldn't go invest in a broader framework or something more expensive or comprehensive, but ultimately you need to understand that even something more comprehensive is probably using 853 under the covers. So it's really important to understand that foundation and kind of trace back whatever you end up doing to assure that 853 is being adhered to, because on the other side of this, the people that are going to inspect your, in a regulatory or breach situation are going to be using 853. So I just wanted to make sure we're all on the same page about that and give you some insights and hopefully some food for thought. So with that, all of these things add up to different types of laws and regulations. We have a span of what happens in terms of the type of monetary fines that you can face. We can see that state regulations, depending on the state you're in, can be from $5,000 to $50,000 per day for a violation. PCI, has its own infrastructure around fines. And then there's things around FTC. FTC is a really interesting one. Not only do they fine, they can take you to jail. Now, I want you to understand when it comes to the Federal Trade Commission, what they're looking at is, in some way, shape, or form, did you mislead those that put trust in you? And a lot of times I'll hear people say, well, we don't have consumers or a hospital. No, you do. The patient is a consumer. You have a financial contract with them. You are representing a set of services to them. And if you represent that your website, your patient portal, your applications, your systems are secure and trustworthy, right? Which is basically what you're doing when they sign that contract with you that says that they're allowing you to utilize their patient data. You could very well find yourself in an FTC situation if it's learned later on that you actually didn't take steps to secure your infrastructure. So it's really important for you to understand the ramifications here and the little nuances, because I think too many times we gloss over things and really don't have a clear picture of exactly what is it that's at stake here, both not only from a reputation perspective or a monetary perspective, but potentially a jail, right, a prison sentence. HIPAA, again, the violations can vary. And I'm not going to get into the rest of these. The point is, ultimately, we need to understand what kind of regulatory impact we can face. And this doesn't bring up any of the civil issues. Now, I'll mention something on the civil issues, which is, more often than not, when we see a breach occur, especially in the healthcare space, we need to be aware of the fact that very often the employees will sue. And that's something that when I've talked to people or we counsel people in a real-time environment is a shocking kind of revelation. But you need to understand, in pretty much all the breaches we've ever seen, we see that lawyers will contact the employees of the organization. They will form a class action lawsuit because in many cases their data has been compromised. And you as the employer have represented to them that their data is secure. And so that makes for a challenging situation. And then the patients also can band together. They're not signing away any of their rights, and that's an important thing to keep in mind. So they've entrusted you with the data. They have the right to sue if you've misrepresented. And I've already mentioned that there's the Federal Trade Commission side of this, which could get rather complicated if things aren't kind of up to speed. Now, I bring all this up because all too often, especially executives, I'll hear, well, we have cyber liability insurance, or we did an audit, or we did an assessment. And, that's all well and good, but if you're actually not practicing what you've signed up for and not making those investments, you could find yourselves in a real serious mess really fast. So it's important that we kind of all understand this. One of the things I'll bring up here about insurers, I hear this a lot when I talk to organizations, especially smaller ones where they say, well, we've got cyber liability insurance. First of all, keep in mind that it's just like any other type of insurance. So if you go out and you're caught drunk driving and you get into an accident, there may be a very good chance that your insurance won't protect you, right? Because you were doing something you shouldn't have been done. And I'm not sure how many people read every line of their insurance policy, but you have the same issue here with cyber liability insurance. And we've seen this play out. There's actually some cases where people had a cyber liability insurance, but they didn't put in place any of the practices. They didn't meet HIPAA requirements. They didn't support or institute NIST 853. And the result of that is that the insurer didn't pay out. And now all of a sudden the organization is in a real serious situation because they're being fined. They have the cost of recovery. They may have lawsuits. and the insurance doesn't cover it because the adjusters are saying, well, unfortunately, you didn't have a password change policy in place. You didn't have the right technology. You didn't have monitoring. You didn't have incident response. This could have been contained, but you didn't respond properly, so the breach became bigger than it needed to be. So please do not take this amateuristic view, and I'm calling it out as amateuristic, that if you have cyber liability insurance, you don't need to worry about anything. You have a lot to worry about. In fact, if nothing else, you need to make sure you have the right practices and procedures in place and governance so that that insurance policy pays out. The other thing is make sure you have the appropriate amount of insurance. A lot of those insurance policies will not cover class action lawsuits brought against you by employers, class action lawsuits brought against you by patients and or consumers. And they're not going to protect you when it comes to a judiciary situation, a legal or criminal situation. Now, I've also heard that a lot of people say, well, D&O will cover that, right? The directors and officers insurance. And unfortunately, that's not true either. There's a lot of situations where D&O will not kick in if there's a criminal or regulatory investigation. So, again, like we said in the disclaimer, you need to go figure all this out. But it's a lot more complicated than some amateuristic view that we've got the insurance, we're okay, we don't have to worry about all this other stuff. You actually do. So let's go ahead and get into the actual HIPAA stuff and kind of shed some light. Now, I'm going to give you a heads up right now. I'm not going to go bullet by bullet on every one of these slides. I'm going to give you the spirit of the slide, if you will, the spirit of the information, kind of give you some insights into what we see when we come out and do assessments, and help you kind of use that as a way to build your own foundation. We certainly would love for you to watch this, call us and say, hey, we need your guys' help. We would love that tremendously and appreciate it more than you can understand. But ultimately, my goal here is to teach you to fish, to give you the opportunity to go do this on your own if that's what you really want to do, or evaluate someone and make sure that they are giving you a level of service that is going to be above beyond your expectations, and hopefully this creates that foundation for you. So let's jump into this, and we're going to start really basic and move into some of the more intricacies of all this. So, speaking of really kind of the basics, right? We have, PHI and PII, right? PHI is personal health information. PII is personally identifiable information, or individually identifiable health information is also another way to think of this, or electronic personal health information. The bottom line here is that we're going to stick to PII and PHI, personally identifiable information, personal health information. And it's important to understand that you're entrusted with that information. And I want to be really clear here, because I often hear organizations that will say, well, we own the data. No, you do not ever own the data. You can't sell it. You can't franchise it. You can't do what you will with it. The patient is always the steward of the data. And, this is a real area that people don't kind of understand, and you'll see more about this coming up and bubbling up as we get deeper into HIPAA. In fact, if you want to mess around with a hospital or a physician practice, they kind of get you upset and you want to give them some extra work, go to them and say, I want to see, obviously, if you were a patient or a legal caregiver of someone, and say, I want to see every system, every instance, everybody that's actually interacted with my data. Now, you as the owner of the data, the custodian of the data, the patient or the caregiver, have the right to do that. And guess what? The healthcare organization has to be able to demonstrate to you what has happened to your data. Because there's fundamentally this contract that occurs between the patient and the healthcare organization that says, we are the steward of your data. We're going to be able to tell you where it is. We're going to tell you how we safeguard it. We're going to tell you where it goes and what happens to it and who interacts with it, because we understand it's extremely personal. And so we are going to be good stewards of that. And because of that, the patient has a right to audit you. Now, it doesn't happen very often, but you need to understand that, because if you don't, fundamentally, you will probably put things in place that do not line up with HIPAA and also in NIST 853. So I want you to keep that really in mind. Now, here's a second one. If you're the patient or caregiver and you really want to mess with a healthcare organization, you could tell them to delete your data. And they pretty much have to delete it as long as they're not actively caring for you and need the information to make a clinical decision regarding you. Or secondly, they don't need the information for billing purposes. So if you paid your bill and you're not under their care, you fired them, they have to delete the data. again, it's really difficult because data lives in so many different systems in a healthcare organization, not even including or thinking about business associates or partners. But the reason I'm telling you this is not to upset the healthcare organization, because some of you are watching this going, why would you tell people that they're going to come into my hospital now and tell me they want their data? Well, it, first of all, it shouldn't create angst to you, because if you have things laid out correctly under HIPAA and in the state 153, this shouldn't be a big deal. But the reason I'm giving you this information is because you need to keep the mentality that you are the trusted steward of this data. And this is going to have a lot of implications later on. And if you don't start from that premise, you start to kind of not truly go as deep and as kind of as deep and as, I don't want to say professionally, but let's just leave it at deep. You don't go as deep as you need to when you're safeguarding the data. And so really important to keep this in mind. So let's kind of talk a little bit more about PHI and PII. All right, now, before we get into that, I want you to not fall back on any excuse that, well, the data we're managing is paper data, or it's electronic data, or it's transmitted, or it's only stored, or it's not stored, or it's not transmitted. Look, the bottom line here is that if you are given data by the patient and you're entrusted it, doesn't matter what form, method, or manner that data is managed or entrusted to you, it still comes under HIPAA. So obviously most things in this day and age are electronic or digital, but that doesn't mean we have any less of a reason to not be careful with printed data or data that's transmitted verbally over a phone. So keep that in mind. Now, let's talk a little bit about the differentiators between PII and PHI. The PII is typically going to be something that you use to identify that patient, or is normally understood or generally accepted to be a way to identify an individual in our world. So Social Security number is a very common way to think of that, right? But also other things, first name, last name, account number, customer number, member number. All of those are considered PII. Remember, it's not just what the world thinks of when we say identify someone. It's also how you as the organization identify that person. And the moment you use information in any manner or combination to identify somebody, it becomes personally identifiable. Because if you're adding tags or anything you're doing to identify uniquely that person, then that's how you identify them, and you need to safeguard that data. Now, we can combine data elements to create PHI, right? If we have no way to identify who healthcare information belongs to, if I just had a blood type and nothing else, all I had is a list of blood types, then there is no PHI because it's just health data. Now, that's part of the concept of de-identifying data, and there's this whole other piece in here, which we're not going to get into, about what happens with that data when it goes from an individual to a population of de-identified data. But it's the combination of PII with healthcare data that creates personally identifiable health information. And that's really important to understand, because the way you identify someone, irregardless of what the greater world thinks, and that health information together is what creates the real focus of HIPAA. Now, I want you to understand that population size of data also matters, not the population of a city or state or geographic location, but the population of the data size. So if you have a situation where there's 500 people and 4 of them have a rare blood disease, and one of those 4 has an extremely rare blood disease, and some way, shape, or form I can figure out that the person with that rare blood disease, the extremely rare blood disease, is John Smith, then even if you've de-identified the data, the fact that I can use the medical information to figure out who that person is, then it's considered personal health information. So you can either identify, so personal health information comes under HIPAA whether you attach personally identifiable information, or you can take the data itself without any personal identifiable information, or what we would traditionally think is PII, and still identify an individual from it. So the population of the data, the amount of data you have, is really important, because sometimes we will see situations where people say, well, we've de-identified it. We've taken out the Social Security numbers and first name and last names and MRNs and patient IDs and account numbers. All that's in there is healthcare data. Well, if I scan through the healthcare data and there's only one person in your hospital that has that blood disease, well, guess what? You didn't de-identify it, and I can still connect that back to that individual. So keep in mind that it's a combination of PII plus healthcare data that comes up with PHI, and then the size and population of data overall can also be used as a way to identify people. Either way, the easiest way to think about this, any data you've been entrusted to protect it, and it becomes a lot less of an argument as to whether this is PHI or PII. I find those to be silly arguments. When I work with people and they're like, well, that's not PII or that's not PHI, I'm like, what's the difference? Because economically, you're not going to save a lot of money by having that argument, right? So unless there's some, really unique thing. Now, being good stewards, obviously, if you're doing stuff for research or academic purposes, you need to really think about whether it's PII or PHI. But in the normal course of security and privacy, not worth a discussion. So with that, let's talk about compliance, right? So there are basically there's these top 5 issues that during an audit come up and kind of bite you. Now, I want you to be really careful here because this isn't the only reasons, but these are the big ones. And if you can solve for these in your strategy, in your privacy programs, in your security programs, this is really important. I want to highlight one thing for you. Make sure that all of this is done as a village. You need to have your security team, your IT security team, and your corporate compliance group involved. And you're going to need more people as we go further into this. But for right now, when you're thinking about, well, what do we got to do to protect ourselves? How do we create this foundation? How do we institute HIPAA? What do we do with NIST 853? These conversations cannot be done without both constituents, IT security and compliance and risk, at the table. And I would even argue you probably want to have your CFO involved because of the cost, and your COO, CMO, CNO involved, your chief medical nursing officers involved, because a lot of these things impact patient care and they impact the economics of the organization. But if we just think about the top 5, again, we don't want to become tunnel vision, but there's a good place for you to start. First thing we hear is that you are not performing annual risk assessments, right? Or you don't have any. So keep in mind, you have to do a risk assessment on a yearly basis. Now, you can do a self-assessment, and there are a lot of good tools, and the government actually even has some self-assessment tools. But be honest with yourself. This is the same as doing the taxes on your own. If you want to go do TurboTax, it's a great tool, but I want you to think about the maturity of that tool and the sophistication of that tool. And it's not that simple, right? It does a great job, but it's guiding you along the way in a very, very controlled manner. So if you're going to do a self-assessment, think about it in the same light as you would in doing your personal taxes. You really don't want to have a situation where a year from now or 2 years from now the IRS calls you. Well, you really also don't want the OCR, Office of Civil Rights, contacting you because the self-assessment you did wasn't as mature or as professional as it should have been. So think about your qualifications, because you're going to be asked, have you done assessments before? How did you know how to answer this question? How did you know you didn't need that? How did you know these were best practices and these weren't? So, one piece of advice I'll give you, whenever I'm thinking about assessments and the way that you deal with your policies and procedures, always picture yourself in a courtroom, right? Think about the fact that you may be deposed, or you may actually be on the witness stand, having to answer for the decisions that are being made. And I can guarantee you that if you think about that end state, which very well could become the reality of life, you will think your security strategy and privacy strategy will be much, much, much more mature than if you think about this in kind of any of the other manners I've seen. So think about how would you feel being deposed or as a witness if you did a self-assessment. If you're confident and you've got the skills to do that, then go for it. If not, you need to look towards somebody or work with an organization that can do a risk assessment, and they have to be performed annually. We'll talk more about those in a moment. We find a lot of organizations have practices. They're changing their passwords. They have firewalls configured. They have some type of monitoring or endpoint protection. But none of it's written down. And here's something to keep in mind. If you have a breach, OCR is going to find out. You're going to have to report it. The Office of Civil Rights is going to know. Now, I think one of the things that most people have in their mind is that OCR is going to show up at your organization, and it's going to be like those news footage that we see on Fox and CNN, and there's going to be a bunch of people with blue jackets that have gold OCR letters on them, and they're going to be carrying boxes and stuff out of your organization into like some van. And that's not what happens, right? Typically, you're going to get an email, certified letter, or phone call, or all three, advising you that they'd like to perform an audit or inquiry into your breach. And then the first thing they're going to ask you for is a copy of your written policies and procedures. And they're going to go through those, and then they're going to look at the evidence that you're going to have to provide to show that you are following those policies and procedures. Now, I want you to, again, put yourself at the end state. In one piece, I told you, hey, listen, you are kind of being deposed, right? Well, here now you're being audited. So I want you to pretend you're being audited. An OCR contacts you, and they're going to be asking you for a copy of your written policies. If you don't have that, well, then you got a big problem right from the get-go. And you could sit there all day you want and say, well, but we know how to do this stuff. That's not going to be good enough, and you're going to have a fine. And more than likely, your cyber liability insurance is going to say, what do you mean you don't have this written down? Where are your policies? Where's your governance? Where's your journals? Where's your audit logs? Where is all that? We don't have that. You've got a bigger problem. Okay, so again, start with that end state. So what did I tell you they're going to want? Your policies and procedures, and then they're going to want what? Evidence. So you need to be thinking about, how does my privacy and security program allow us to provide evidence? Okay, now again, you can do this through an assessor, or you can do it on your own, but you got to have these things. No, I don't care how you do it, you got to need them. Business associates agreements. Okay, let's talk about the scenario we have here. A patient comes to you, it signs an agreement, right? That little form that says, yes, you can have access to my data and use it for clinical, blah, 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 blah. I want you to take away two things from that. One, you are creating a trusted relationship with the patient, a contract with them, okay? And I'm sure your lawyers have looked at it and they're telling you it's good. Here's the second piece. It doesn't matter what your lawyers say, and it doesn't really matter what that piece of paper says. You should have it, should be good, but ultimately, external entities are going to review and understand that the spirit of that was that you were protecting their data. Now, this is really important. We've talked about this trusted relationship between you and the patient, your organization and the patient. So the patient's giving you the data. You're basically saying, okay, you're signing this agreement that I can share this with others. Here's the gotcha. That patient is under the assumption that you are going to share that data with other organizations as long as they maintain the same level of security and privacy that you do. And we always, when we're looking at business associate agreements, find that most business associate agreements do not require the BA. There's no language in there that says you must maintain your security at the same level that we do. And that's a big problem. So I want you to really think about that what you're doing in that trusted relationship as the covered entity is that you are basically, on behalf of that patient, protecting their data with anyone you share with it, and it's on you to make sure that wherever that data goes, inside or outside your organization, it's at the same level as you. And here's why. Let's go back to our deposition example. You're in a courtroom. I'm the attorney, which I'm not, but let's pretend I was. And I say to you, ma'am, sir, did you have XYZ procedure in place? Yes. Why did you have that in place? Because we felt that that was important to have in place to protect the patient's data. Very well. Did your business associate have that in place? Well, I don't know. You don't know, but yet you shared the data. Isn't it important to make sure that whoever you share that data with would have the same level of security as you did? You said you needed it. You said that you had to have it in place because you felt that was required to protect the data. Did you not take the same measure of protection when investigating that business associate? Well, I guess not. Okay, so where do we go from there? It's a problem. You have to make sure that your business associate agreements are in place and that you are enforcing them. And by enforcing them, that means you are doing at least a yearly assessment of a population of your BAs. Now, there's a lot more to this, right? And some of you are going to say, well, how do we, I have 700 BAs, I have 1,400 BAs, I can't go out and do that. Well, then you need some process that allows you to kind of figure out, hey, based on this group of BAs, we're going to go look at this percentage every year. That's our process. Every year we look at 10% of our BAs. And we actually do a deep dive assessment of every one of them. And the second thing we do is we send a questionnaire to all of them and ask them, what are you doing? Are you maintaining this standard? Now, there's another way that you can do this. And the other way is asking your BAs to give you copies of their risk assessments and their penetration test results. And ask them what they're doing about remediation. And you can document that. The point of this is you need to demonstrate, if you get audited, if you get sued, if you have a cyber liability claim, that you are taking steps to assure that the BAs are maintaining the same level of security as you. And if you can't do that, you've got a gap, okay? Hopefully this makes sense. Every time, by the way, every time we look at a BA agreement, like I said, none of them have language to this. So, you know, it is what it is. The other thing about this patient-CE relationship where the patient's coming in, understand the patient has no legal training. So they're finding a form thinking, and they can make easily the case that, you know, I signed it because I had to get treatment. I was trying to take care of my mom. She needed care. I just signed it. I really didn't know what it said. And we all kind of know what happens when somebody signs something that they don't know what they said. And we can make the case that it was kind of in a duress situation. You may not have been twisting the arm, but the circumstances created stress. And so then guess what? The litmus of that trusted relationship is going to be defined by other people. And that test is going to be rather high. Right, authorization and audit is inadequate. And this is where we go back to that example of somebody going into the hospital or the practice, the physician practice, and saying, show me everywhere the data is, right? Show me how you're protecting it. Show me who is allowed to see it and not see it. Okay, so authorization and auditing. Where's the data? Where does it live? Where's it going in the organization? And then security awareness training. And here's the thing about this. We'll talk a little more about it later, but HIPAA is not about giving you a requirement that you have to train people once a year on HIPAA. Now, we do that, and it's a good practice. But if we look at NIST 853, which is the underlying framework for HIPAA, what we really are talking about is an ongoing awareness of the responsibility required for privacy and security. So you have to do ongoing training. It's not just once a year, watch a video, take a quiz, and check off some answers, and then you go, okay, yeah, everybody goes through training here. That's not training. That's not, in this day and age, going to cut it, right? And so you need to think about security awareness training needs to be much more. Now, thankfully, it could be simple. It could be posters. It could be an email you send out once a month reminding people to be careful about what they're doing, how they're sharing data. It could be anytime there's a new attack that comes out in the media, you send an update and say, let's be aware of this, let's be careful. So it's not really crazy expensive. You don't have to get everybody in a room and put them through ongoing training, at least not in the end user community. But we'll talk more about this. But those are the 5 things. I'm hoping I'm giving you kind of like some aha moments here because we're not even into the meat of this. And as you can see, a lot of this, you know, to me, it's kind of common sense. But I'm hoping that I'm trying to take a different approach, maybe a more assertive approach that leads to you having the ability to concretely say, yeah, I get it. I need to do these things. And here's why, right? Because I don't want to, you know, we're working from the end state backwards, I guess is how to look at it. So let's talk a little bit more. Now, here's an interesting issue because, you know, again, going back to that cyber liability insurance, oh, we're okay, we're fine. Well, over 90% of the breaches have had some form of corrective action, which means what? They got fined. And guess what? The insurers are going to have privilege to what the OCR finds. It's not confidential, it's public information. So as soon as that happens, your insurer can say, hey, wait a minute. You guys didn't change your passwords? You didn't have endpoint protection? You didn't have monitoring in place? You didn't have security awareness training? You didn't have authorization? You didn't have a BA agreement in place that allowed the same level of security and protection as you? Why do you expect us to pay? The policy says you have to maintain best and ongoing security practices. So get what I'm saying? 90% of the OCR investigations required some type of action. So what are the chances that you're going to get through this if you don't take this assertive kind of different view of HIPAA that hopefully you're hearing come through in this presentation? So what's the security rule cover, right? The security rule within HIPAA, which is basically the ruling that says this is HIPAA. Well, it covers entities and business associates, and it basically just says that you have to do these 4 things. And those 4 things, unfortunately, create a massive amount of work, but I'm going to try and find ways to make it easier for you, right? And kind of make it a little more manageable in terms of how do you get yourself in a position where you could withstand an audit, where you could get paid out on your cyber liability insurance. And those 4 things are you got to ensure confidentiality and integrity, right? And so protect the data. Make sure that it's maintained confidentially, whether it's electronic or through human correspondence. Make sure that you protect against reasonably anticipated threats. Now, there's something in here I want you to understand. Lawyers and others will argue that, well, what's a reasonable threat? I don't know if that's a reasonable threat. That doesn't sound like a reasonable threat. Let me put it to you this way. If it's in the news, it's a threat, and it's pretty reasonable that you should know about it. So don't play the game that, well, I'm not sure if we're going to get attacked by ransomware. If you know what ransomware is, if you've heard the letters APT, Advanced Persistent Threat, if you know what a phishing attack is, if you know what vishing and social engineering are, then you need to go protect against them and not play this ostrich game where, oh, well, we don't know, nobody's informed us. That word reasonable could be defined many different ways. You're not going to win the battle, okay? Because here's the other side. What happens if I'm the expert witness that they bring in and they ask me to define reasonable? And I'm going to say, yeah, in a context of a cybersecurity privacy officer and or compliance officer, it is reasonable to expect that they would know that under the current threat landscape, you should probably have protections in place for ransomware or phishing or advanced persistent threat or whatever the myriad of stuff that's going on. The point here is you need to understand the current threat landscape. And you can do that through education, threat intelligence, in a variety of different ways. But do not fall into the trap of saying, well, we don't really know what reasonable means. That's, who's to say? That's just childish. It really is. We're talking about people's data and potentially their lives. We're healthcare professionals. Our job is to protect the quality of life. So if that's the argument we're going to make, probably should have chosen a different industry. Okay, reasonable anticipated unauthorized use. Well, that's again another one. We all kind of know what it means. We don't need to get into this gray area. It's a lot cheaper, easier, and less embarrassing to put protections in place for unauthorized or use or disclosure of data. Screensavers, right? Not displaying names on a overhead whiteboard, things of that nature, or adjusting our documentation and policy so that if we have to do those things, we at least disclose it to the patients and those who the data actually belongs to. And ensure compliance, right? This goes back to security awareness training, right? Again, think about the deposition, example I've given you. So I depose 2 or 3 of your key workers, not security people, not compliance, not C-suite, just 2 or 3 nurses, 1 or 2 doctors. When was the last time you went in training? Well, we have training about once a year. How long does the training last? Well, we watch a video. You watch a video. Were you aware of a ransomware attack, ma'am? Yes, I heard about it on CNN. You did. Did your company come out with any education, any information on what you should do if there was a ransomware attack against your organization? No. I mean, we talked about it in the break rooms and we kind of all wondered what was going on, but nobody ever told us anything. Okay, you understand what I'm saying? You understand how security awareness training plays into this and how it can come around to really harm you? And, this employee is not doing anything but being honest, right? And this is probably what goes on. So those are the 4 things. Now, the security rule has a structure. And again, this is another area we get tripped up in. There's the standard, right? And then the implementation. So the standard is, hey, you need to do this. It is highly suggested you do that. It's just basically, this is the standard that we want, okay? Now that standard changes, and I can't say this enough. It changes based on the current threat landscape. If you have policies that were written 10 years ago, 5 years ago, 3 years ago, a year ago, and they are not updated to deal with attacks that are happening today, then you've got a problem, okay? All the standard is, and don't go saying, well, we were looking at NIST 853 and the last revision is revision 5 or 4 or whatever, and that's what we're using. It doesn't matter. Your excuse should not be that NIST wasn't updated, so we don't have to update. No, you are the dynamic part of the equation. You must update your policies and procedures so that the standard can reflect the current threat. Okay? So keep that in mind. Second piece is, what is the implementation specification for the standard? Now, there's 2 ways. One is required, one's addressable. Required simply means that you are required to do this. Okay? The second thing is addressable, which we're going to talk a little bit more. So I'm not going to spend a lot of time on required because it's pretty straightforward. If the security standard, if inside the HIPAA regs or NIST 853 it says this is required, then you got to do this, right? If there's a requirement for, and I'm making this up, for threat intelligence, then you have to do it, okay? If there's a requirement for password changes or that systems should maintain a minimum password complexity, you have to do it. So wherever you see required in NIST 853, you need to do that. So let's talk about addressable, because this is the one where everybody kind of tries to find a way out. Well, we don't have to do that, right? That's an option. Okay, let's just get to the end of this thing. Addressable does not mean it's optional. Addressable means that you have the ability to explain how you're going to do this for your organization, and it may be different than another organization. But here's the thing: if you're comparing yourself to another organization of similar size, complexity, financial, and human resources, and they are able to do something, then you should be able to do it too. So be really careful when you're saying, well, we can't do this because we don't have blah, blah, blah. And, but we're the same as this other organization. Make sense? First thing, make sure that if you're going to find a way out, because addressable gives you the ability to say, we can't do that. We can't afford it. We don't have the technical expertise. We don't have the money. We don't have the humans, right? It would get in the way of patient care. Well, that's fine. You can do those things. You can say, we're not able to do this because of these things. But you better make sure they're truly legitimate, defensible items. We go back to that deposition, and I depose your CTO or your IT security director, and I ask them, do you think this could have been done given your current resources, level of skills? Yes. Would you have had the money? Well, yeah, we proposed to the organization 3 options on how to do this, and that also involved not using, blah, blah, blah project, and we could have had the funds to do that. Okay, you understand what I'm saying? You really need to make sure that with addressable, my advice to you is you consider it required unless you can truly defend why it's not. Now, let me take a step back. If you really can't afford something, let's say you needed to put antivirus in place, which you should. And this is an example, okay? Please don't take this as a suggestion. I'm just using this as an example. Let's say you had to do antivirus and you couldn't afford the very best antivirus out there, and you had to go with something that was free. Or for some reason you couldn't even do that. You didn't have anybody to install the antivirus software for you. Well, as long as you can explain it, that's fine, but you should do something, right? Addressable means do the best you can with what you've got. Is the best way to look at this. Do something. You're better off doing something and doing your best and really truly the best you can than doing nothing and trying to explain why you did nothing. Again, let's go back to the idea. It's not just regulators, right? You're trying to explain this to regulators, cybersecurity liability people, cybersecurity insurance adjusters, potentially employee or patient lawsuits and civil suits, potentially a criminal inquisition if it's Federal Trade Commission coming after you. And every one of them is going to look at it from a different lens. And so you might win one of these arguments. Chances of winning all 4 or 5 gets really slim. So we've already kind of covered this, right? There's some flexibility when something's addressable, but you really need to explain your size, complexity, and capabilities, your technical infrastructure, the cost of the security measure, the probability and criticality of the risk. Now, all of this, can be considered in light of the operational impact, right? So we all know dual factor authentication is probably the right thing to do when it comes to securing our systems. But there is an impact in dual factor authentication of treating somebody in an emergency room or an operating theater. And so you may not be able to do that. And that makes complete sense. And that's something that's defendable, right? The extra few seconds that it would take to, or the unreliability of a cell signal to transmit a code to somebody's cell phone, the potential for infections being introduced if you had to look at your cell phone to unlock a screen in an operating room. Those things make sense, but they have to be documented. You have to document whatever the reason is that you're not going to do this. All right, so I'm hoping I made sense, and I hope you understand this is not an option. You've got to explain it, and it's got to be a defensible explanation that is documented and can stand the test of multiple venues looking at this, multiple constituents looking at this. All right, so within HIPAA, we have multiple safeguards: administrative, operational, technical, physical. Each of these safeguards is basically an area, a category, if you will, that basically says, hey, within this category, you got to do all these things. The best way to look at this is go to NIST 853, and you can get the document for free. Like I said, the entire framework's free. You get it off the NIST website, or you can just search for it on the web, NIST SP Special Publication 800-53. And and just look at the different categories, and those are basically the safeguards. The administrative really talks about policies and procedures. It is what it says it is. It's the administrative side of managing your practices and procedures, right? It's really looking at how you're going to do risk management and analysis. What's your sanctions? I want to talk about sanctions for one moment. One of the big things also we see is often that there are policies, there are procedures, there are practice, and there's evidence of it. But what we don't see is what happens for the violation of a policy or procedure. And that's really important. There has to be some kind of teeth to this within your organization. You can't just say, well, we do have a policy for not changing password, for a minimum complexity of a password. But if somebody doesn't follow that, nothing happens. Because then it's truly, there is no gravitas, if you will, to this policy or this procedure. You must have sanctions. And those sanctions, you have to be able to demonstrate that they were taken. So if somebody does violate a policy, you have to have the supporting evidence that shows that when these people did violate a policy, here's what we did. And you really need to make sure those policies are going to get enforced. Here's one of the things I see in healthcare organizations all the time is you have a set of policies for doctors and a set of policies for everyone else in terms of sanctions. Here's the thing, you can't do that, right? Now, you can only do that if you can explain why that would impact patient care. And that should be applied across anybody, right? But here's the thing. Too often when I see this, the only reason the sanctions are different is because that person's a doctor. You know, look, I understand the reverence that people give doctors within healthcare. I truly do. And I have a lot of respect for that. But when it comes to this stuff, you can't stand in front of a regulatory body or anybody else and say, well, the only reason they didn't get in trouble was because they were a doctor. You just can't do that. It's not a good practice. You're going to have a situation where somebody's going to say, so you knew it was wrong, you knew they should have been corrected, but they didn't get corrected because they were a doctor, and that led to this breach, which not only stole patient data, but impacted care or life. So sanctions are really important. They need to be enforceable. So whatever you put in place, you can have whatever sanctions you feel is appropriate. Make sure they're real, and make sure you're going to enforce them, and then document that they've been used. Workforce security, you know, how are you managing terminations? How are you managing the clearance procedures? So this is all pretty straightforward. It's really the administrative side of managing your organization. So I'm not going to go into all of these. We talked about security awareness training, things like security reminders, making sure the information is relevant. You think about the kind of situations where stuff is heard in the media, you know, and you are doing something to not only update your policies and practices, but you are also going to update your workforce around, hey, there's this stuff going on, and here's what we need you to know about it. Okay, so really important. The other thing about this is governance. You know, and this plays into maintaining that current threat landscape and assuring that the policies and practices are timely and current. And that is that you need to be looking at policies and procedures and practice on an ongoing basis. Now, ongoing, you can define, the worst case I would say is yearly. The best case is probably quarterly, right? That every quarter you're kind of taking an hour with a representation of your organization, whoever is responsible for policy, and seeing, is there anything that's changed in the environment, changed in the landscape of threats that you have to do. And there's some other best practices around governance that, you know, I don't want to talk too much about here. We're happy to tell you about them. That makes it easy. You don't have to have 8-hour meetings to deal with governance. And there's some tools out there that can help you. But overall, you need to make sure that you have some governance model in place that is helping. And the goal of that governance should be assuring that the policies are being kept up to date and actually being enforced and implemented and practiced, right? So we'll talk more about security incident response, contingency plans. You have to have some form of data backup and restoration. This is critical. It's not just, hey, protecting and securing the data, but also assuring you can reproduce the data and recover the data. And so, again, that's really important. And we've talked about the whole discussion with business associates. We've talked about that already, so I'm not going to go any deeper into that. But just to reiterate that business associates must be at the same level that you are. You have to audit them or assess them once a year, hopefully, at least. If you can't get to all of them, do a representative sample and rotate that sample. Do surveys, questionnaires, ask them for their results of their stuff to prove that they're doing result assessments and testing. You may also want to think about when somebody's brought on as a business associate, a new business associate, being able to demonstrate to you that they're doing these things. So think about all that as you kind of think about the administrative side of this. How are you going to administer the entire program? All right. The second piece here that kind of comes up is the physical safeguards. And this is all about, you know, protecting the physical infrastructure that houses the personal health and identifiable information. So this is, you know, the data center, the places where the computers are kept, the wiring, you know, your wireless infrastructure, anything that's physical, that can be touched, and how that implicates or supports security and privacy. Okay, is the easiest way to think about it. If it's physical, how is that either creating a security risk or helping minimize security risk? And so physical security is a very serious situation that most people don't tie back to HIPAA and NIST 853. Now, this could be anything from, are you displaying information? Are you leaving papers out? How are you dealing with printers? How are you dealing with faxing? How are you dealing with any of the physicality, right? How are people accessing your environments? How are they getting into your facilities? Who's being tracked? A big one here that we often find is that for a data closet or data center, you need to have a log of who's going in there and why are they there, right? If you have a bunch of servers in your infrastructure, then who's going into that data room or that data center? Now, two things to keep in mind. One, if you're really large and using cloud environments, you still have a responsibility. Again, the BA has to maintain the same level of security as you feel is important for your data. So if you have a cloud environment, that cloud vendor needs to be able to show you that they're maintaining logs, that they can track and audit who is actually accessing your equipment, who's seeing it, how they're protecting it from other environments. All of that has to be there. If you're really small and you're not doing, you know, you have a bunch of servers under a desk, you need to move them into a secure locked room, right, with access control so you can prove who's doing it. You can't just have a server under a desk. It just doesn't matter, right? Size, HIPAA, you know, allows you some flexibility in terms of how mature your practices are, but there are some things that, you know, you just can't look the other way on. They have to be done correctly, and physical security is one that you really need to think about. So the other thing around physical security is the disposal of media, right? And this sometimes we think about with how are you destroying laptops and machines, but what are you doing around USB drives? You know, how are those being destroyed? We find this a lot with cardiology practices where they will put a strip onto a USB and then share it or move it from one system to import it into another. Same thing with radiology and imaging, where we'll see somebody take imaging data on one machine, put it onto a USB, and then move it to another machine and import it into the medical record. That's all well and good, but what happens if that USB drive gets lost? How do you know who had it? How does it get destroyed? How does it get tracked? Okay, so again, I'm just trying to give you insights into these common things we do every day and don't really think about sometimes that this is part of our security and privacy and requirements. And so keep that in mind. We've talked about data backup and storage and tracking that, so I'm not going to go too much deeper into that. So again, physical safeguards are really just everything that has to do with protecting the physical world that surrounds our digital world or our paper world. Remember, HIPAA is also about the paper that we produce, and in many cases we still produce paper. Patient instructions, you know, charts. We fax or transmit information for a referral. All of those things come under the HIPAA policies and procedures. Technical safeguards is the technical side. So the administrative is all about how we're going to administer and manage this environment. And the physical is all how we're going to put the physical facility around the environment. And the technical is the actual day-to-day kind of geeky side, right? Which is password controls and monitoring and all of the other pieces that go in place that require us to really think about, you know, how do we actually carry out the administrative pieces of our policies and procedures. So, you know, not only are we concerned about how data is stored, but how it's transmitted between computers and systems within our organization, but also external to our organization. So the next piece I want to talk about is you had a breach, okay? So what do you do, right? So first thing is, and this is a little bit of a trick question, how many records do you have to have breached before you report it? Now, I've told you a lot of stuff in this simple presentation, so some of you could guess, But the answer is one. You have to have one record breached before you have to make a notification. Now, you may go, what do you mean? I thought it was 500. Well, that's a separate kind of special case. But if one person's data is breached, you have to notify that one person. Why? Because you have a trusted relationship. You have entered into a relationship with them, and whether your document says it or not, there is an expectation that you are going to notify that person if in any way, shape, or form you lose or the data becomes compromised. And so here's something I want you to keep in mind, because very often I'll hear about these conversations that attorneys are like, well, should we disclose it or shouldn't we disclose it? Should we do this or should we do that? Should we call the FBI or should we not? Okay, those are kind of silly conversations to have. But here's a little thing to help you if you ever do get into those conversations. And that is that the patient has no obligation to not disclose what has occurred. And you really need to think about, well, if you have to notify a patient that your record was compromised, that patient has every available means to go to Facebook or Twitter or wherever they want to go and say, XYZ organization lost my data. Maybe you should check with them to see if they lost your data too. XYZ organization, apparently a hacker got to my data. Maybe you should check to see if a hacker got to your data. My point of this is, if you're going to have this debate over whether you should disclose or not, you're probably you're spending your time in the wrong place, because the patient doesn't have to have that debate. They are well within their rights to explain this to whoever they want. And we all know how quickly social media spreads. So rather than invest time on should you or shouldn't you do something, invest in how you will deal with it and what should be your response to the public overall, because it's probably going to get out. But the important part here is you have a contract with that patient, and it's expected that if you have any impact to their data, they are advised of that impact, the extent of the impact, and what the remediation will be for them. So hopefully that's kind of eye-opening, and hopefully the piece that reminder that the patient's under no obligation to maintain confidentiality is also eye-opening for you, because it's an old school kind of approach to have those debates of, well, should we or shouldn't we tell people? So breach rules have changed. We need to keep in mind that it's really now about the compromising the security or privacy of the protected data. The harm standard, which was, well, was there any harm brought to the patient because of this, is gone. So it's really just, was the patient's data compromised? Was there security or privacy compromised? If it was compromised in any way, shape, or form, then you have a breach. And that's an important little subtlety that you need to really understand. Now, one other debate that comes up a lot is ransomware, right? When we've had ransomware attacks, we'll often hear people say, well, we didn't know if we didn't feel we had to disclose it because we knew we had the data, there was no harm, blah, blah, blah. Well, here's the thing. If the data is compromised, then you have a reportable breach. And if you have 500, 600, 700 records that have been affected, 1,000 records, 10,000 records in a ransomware attack, you've got a big breach. Now, it's important to understand this because breaches are now considered a reportable event. And the reason for that is you've lost control of the data. So I want you to think more about the reason a ransomware attack is considered a breach versus the fact that, oh, ransomware is a breach. The reason a ransomware attack is a breach is because there's been a compromise and you no longer have control of that data. You have no way to prove that you can, return that data to that user. Remember what I said, the patient is the ultimate owner of the data. So if they come in and ask for their data, you can't give them their data because it's encrypted. You've been compromised. So if there's a new attack in the future that in any way, shape, or form compromises data, from a security and privacy perspective, you need to kind of realize that you're probably going to have to report this as a breach. It's very hard now because that harm standard was removed to say, well, this isn't a breach. We can debate whether any harm was done. There's no discussion any longer. The breach rule has changed, right? Hopefully that made sense to you. So there are some exclusions though, and this is not considered a breach, but you got to be really careful with these. One is unintentional acquisition, all right? Now, this means you have somebody within your organization, your workforce, that came into contact with data that maybe they didn't need to see. That's not considered a breach, right? So housekeeping sees something they shouldn't have seen. Something along those lines, right? Data was inadvertently sent to by email to another member of the workforce, but yet, you advise that member not that, they shouldn't have got that, you're sorry. That's an unintentional acquisition, but it's within your workforce. Inadvertent disclosure by person authorized to access. Again, I send an email to someone with some attachments and inadvertently share that information with another member of the workforce. Again, that's not considered a breach. If somebody's not able to retain the information, so I send, in some way, shape, or form, I send something to someone and they have no ability to retain it. This is a really hard one, because I can tell you right now, if it comes to my computer, you're going to have a real hard time trying to state that you can't retain the information. Now, I'm going to throw something in here to kind of give you a little bit of just something. This is an aside. This isn't on the slide. One thing I often hear is, well, if it's encrypted, it's fine. So I want to explain a couple things. One, encryption does not stop an attacker from getting to your data. If I am an attacker, I attack computers all the time, and it's something I do. And I can tell you that to get around encryption is not that hard. I don't have to break encryption. What I have to do is get your credentials, and that's a lot easier to do. If I get your credentials, your user ID and password, and log in as you, then guess what? I'm running as you, and you have rights to get to the data, and the encryption isn't an issue for me. Your account will decrypt the data. Does that make sense? So encryption, just because something's encrypted, is not a reason that you suddenly can claim that the data was not accessible or wasn't disclosed. And we often hear this where somebody loses information. So somebody's laptop gets broken, a car gets broken into, laptop gets stolen, and suddenly we find out there were 2,000 or 3,000 there was 2,000 or 3,000 patient records on there on a spreadsheet. And I hear people say, oh, well, it was encrypted, it's no big deal. Well, there's basically a few things you have to prove. Just because it was encrypted doesn't mean you don't have to report it. And second of all, you have to be able to prove a few things if that laptop was stolen and it had encryption software on there. The first thing is, how do you know the credentials were or were not compromised? Because again, I told you, if I get your user ID and password, then the encryption doesn't matter. So you have to demonstrate that there was no possible way that the user ID and password were not compromised or acquired by the person who took the laptop and or got to some other server that was encrypted. So you have to show that. The second thing is you have to demonstrate that the encryption that was being used is of the latest, greatest standard, that you have the right patches, updates, software, and that no other vulnerabilities exist on that machine. All right, so let's separate those, right? 2, that the encryption is the latest and not breakable. If you have old encryption or the encryption was misconfigured when installed, then the attacker can get around the encryption. Make sense? Old encryption I can break. Misconfigured encryption, I can get past. Third, does the machine have any vulnerabilities that would allow me to access the machine as an administrator and or other user, which would then, bypass encryption? So that's the third test. And the last one is, how are you protecting the encryption keys? Because if you don't have protection around the keys and I was able to get to the encryption keys, then again, I can bypass encryption. So I'm trying to give you this insight because when we get into these conversations of breaches, it's always a silly kind of debate around, well, is it really a breach or wasn't it? And, we can argue it all day long, but from a technical perspective, there are things you need to understand that kind of bring to light, like, oh yeah, we didn't think of those things. So my hope here is to kind of give you this boot camp approach to HIPAA that kind of opens your eyes to things, not because I'm trying to make it difficult. I'm really, really trying really hard to kind of give you opportunities not to get yourselves into trouble if you ever have a situation where you are being audited or there's a regulatory review or whatever it may be, right? These are the things that are going to come up. These are the ones that get you, and why we have 90% of breaches have some kind of, some kind of fine and or other penalty associated with them. So, all right, so we've talked about breach, let's see. So if you've had a risk assessment, you have the possibility that you can exclude yourself. Now this gets a little complicated, so I'm not going to go deep into it, but you should understand that if you've had a risk assessment, you may be able to go through a set of steps to demonstrate that the data that was compromised was okay. And, there was no violation because your risk assessment showed that that would have actually been protected under those steps. But it gets a little bit tricky. And you have to have a lot of auditing and authorization in view. And if you really want to talk about that, you can let me know and I'll be happy to talk about it. But I want to kind of just at least plant the seed in your head that there is this risk assessment exclusion under the breach notification that you can possibly take advantage of. But again, you have to have a really great risk assessment in order to do this. I would tell you probably your self-assessment isn't good enough, and you've got to be able to demonstrate the evidence that this risk assessment is being addressed and that you have all the other stuff in place. So make sure that before you go down this path, you've remediated what you have to remediate on the risk assessment and that it's a really, really solid assessment. So it's a breach. So let's say you had a breach. What do you do now? Panic. Well, if you do, you've violated HIPAA because you shouldn't be panicking. You should be executing your incident response plan, right? And most people don't know, but an incident response plan is required. It's not optional. You have to have an incident response plan, a cybersecurity incident response plan. You must, that plan will talk about how to notify individuals, what works for your organization, what's been reasonably believed. It's going to determine if you have to notify the media and if you have to notify the secretary. There's also a bunch of other things that happen in an incident response plan. So the individuals and some additional requirements. You have about 60 days after the discovery of the breach to make your notifications. You need to check on that because it could change and it could be different for your organization. So you really need to think about that. Depends where that data lives. If it's on a medical device, it could be vastly different than if it's on a server. So you need to research that and figure out what's the right timeline. You know, you have different elements that you have to advise people of. What happened and when, what was involved, what type of data, what were the elements of the data involved, how do you know it's PII, PHI, why do you believe it is, what steps you've taken, what steps the individuals should take now that they realize the data has been breached, and what steps you're taking on their behalf, and, you know, kind of what to do from here, right? So this all should be in your incident response plan. Everything should be in plain language. The worst thing you can do is make this a technical or legal document. Really a bad thing. You need to be able to demonstrate that you were very clear in your communication with the patient or the individual that was compromised, the caregiver or care authority, and you know that they understood the implications of what was going on. The only way that you can kind of get a delay on disclosure is if law enforcement's involved, right? So if you contact the FBI or the Secret Service, depending on what is going on, and you should have relationships with both of those entities, your local FBI and Secret Service office, they could request that you delay any notification, and they have the right to do that because it would be at that point a criminal investigation, and you don't want to do something to obstruct a criminal investigation. The burden of proof is always with the covered entity. You know, so if a BA does a breach, it's not up to the BA, it's up to you, the CE, to figure out what happened to the data with the BA, and basically you're launching an investigation. Now here's something really interesting. A lot of cloud providers will not allow you to perform an investigation on your systems that you're paying for if there's a breach. So that's a really important thing for you to think about when you're contracting with cloud providers. You know, what rights do you have to perform a forensic or other investigation into a breach? They're the BA, so you are the responsible party for the investigation and the notifications. And you can't make an appropriate notification if you don't know what steps have been taken, what data has been involved, right? All of the other stuff you have to be able to speak to. So there's a piece of this that's forensic. And what rights do you have from the forensic perspective if you're dealing with a cloud provider? All right, big thing, document everything you do. Everything you do from the moment you discover there's a breach, who was contacted, when, where, what was done to the systems, who had access to the systems. It's a whole class on this, and it's beyond what we can go into here. And so we kind of went through all this, so I'm just going to go on to the next big piece. Things that you need to be doing. So we've talked a lot about the rules and how they can impact you and some of the challenges and ways to think about things when you're creating policy and why it's important to do some of the things you do. And so what should you do? What's it all boil down to? Well, honestly, all of the stuff I just told you comes down to doing three things, okay? Running a cybersecurity and privacy risk assessment, doing a vulnerability assessment, and ultimately doing a pen test. Okay, these are the three things you have to do. Whether you do a self-assessment or not, you got to get a risk assessment in place on an annual basis. You have to have a vulnerability assessment, typically on an annual basis, and you should be doing a pen test on an annual basis. Now, the last two, you could say, well, I don't see that in the regs or whatever. It's a best practice, and it's part of implementing a foundational approach that assures that you have tested your policies, right, and your procedures, and that you have done so in a manner that's not just speculative, that, oh, well, this should be good enough, this should work. These three practices help demonstrate that you have taken the steps to really truly assure that you have a secure environment. Okay. Now, it's not just doing this. You obviously have to address any of the outcomes, remediate any of the or implement the recommendations that come from these activities. So, the risk assessments, big thing here, the people doing it have to have knowledge of cybersecurity and privacy. They have to be able to demonstrate. Again, let's go back to that deposition. How many risk assessments have you done? Well, I've never done them before. I just got the job 3 years ago. My organization asked me to do a risk assessment. So you've never done these before? No, I have not. Well, how'd you know what to look for? Well, I read up on it. Okay, well, that might work or may not. I don't know. But you'd probably rather have somebody on the stand who's going to say, well, I've conducted 28 risk assessments that are NIST 853 based. I have, lectured to the Office of Civil Rights on performing audits, and I'm also an attacker, and I've breached the security of multiple systems. So I have the wherewithal and the ability and knowledge to understand where security gaps typically exist and the level of risk they pose to an organization, as well as I maintain currency with current threats and blah, 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 blah. Point is, you can't just run it. You need to assure that the person has the knowledge and security. And I want to also address something else here. It means your IT security and compliance teams must have the right security. You don't want a situation where your IT security team doesn't have the training to configure systems and endpoint protection and intrusion detection and manage firewalls. They need the training. You don't want a situation where your IT security team is saying, and we've had this happen where we're going to speak to them, say, when's the last time you attended any training on firewall configuration for your product you're using? Well, we never have. We kind of just watch some YouTube videos. This is not going to work well for you, right? Especially if the firewall was breached and everybody knows you shouldn't do this or you should do that. These are highly complicated technical devices. So make sure your people have the right training, but make sure also the people performing assessments and pen tests and all of that have the right backgrounds. It's got to be repeatable. And that means is that if somebody else were to come in and perform the assessment, that they would come up with typically the same results, right? You don't want a big sway that if one person does an assessment, they find 80 things, the next person comes in and they find 300. That would be a big problem. So make sure it's repeatable, and understand that, all of this is done against the backdrop of, all of this is done within the context of what your organization's complexity is. So make sure you understand that the assessment has to be right-sized for your organization's complexity and capability. You should always make sure that the risk assessment does not compromise your security controls. One of the things we do and our partners do is once we give you the information, we get rid of it. Now, we have had situations where we've done pen testing on internal networks of clients, and our team will get onto the network, be able to traverse it, get to the IT security team's folders, and find previous risk assessment findings. Well, that's a problem. You need to safeguard the risk assessments. So you want the partner or whoever performed it to delete it from their systems, and you need to, in your environment, make sure this is maintained in a highly secure way. You don't want an attacker to get to this documentation. And that's a big problem. You don't want these sent to you over email. You don't want somebody to just send it to you in the mail. You want the reports and all of the collateral that comes from a risk assessment to be done in a highly secure manner. Okay? So there's a program called the Sensato Rapid Assessment Program. I'll talk about that in a moment. We highly recommend that you do a full NIST 853 assessment, that's your goal, regardless of the size of your organization or the complexity, that you eventually get a full NIST 853 assessment done or better if you're doing something that's more advanced than that. But at the very minimum, get your organization through a full NIST 853 assessment. Make sure it's crosswalk to HIPAA. It is the foundation for other assessments, and we'll have some. We don't do them, but I'll give you some partners that we use to help you with that. You need to do a pen test. Your pen testing should be a variety of different types of pen tests. There's not just one. So you want to do a vulnerability assessment if you do nothing else. This is usually a combination of an automated and manual approach. You want to do social engineering, right? Seeing if people in your organization react to emails that they shouldn't be reacting to. Do they give out their credentials over the phone? We have a lot of success with this when we call people up, tell them we're working on a special project and we need their user ID and password. You'd be surprised how often people will give us that information and never confirm with anybody internally who we are, what we're doing. And then there's what we consider kind of the system testing of pen testing, which is doing the external, seeing if we can get into your organization from the outside using any of the public-facing IP addresses or public-facing systems. The internal stuff, looking what happens once somebody gets into your network. Where can they go? What can they access? How's your wireless security, right? So that's another set of tests. The applications that run on your network, who is assessing those from a security perspective? And then what we would recommend if you go through all of that is a red team assessment, which is really where you say there's very few rules, do whatever you want to do, see how far you get, just like a real attacker would do. I would tell you everything other than a red team exercise is not truly a real world attack, because you're going to have rules of engagement. And once you have rules of engagement, once you tell somebody you can't do it during these hours, or try not to knock down our production server, or stay off our production system, then it's not a real pen test. And that's okay. I'm not saying there's anything wrong with that. I understand the challenges, risks, and kind of emotion tied to that. But it's important that you at some point, a year from now, 3 years from now, make it a goal to get through a red team exercise, to really understand where you truly stand and what could happen to you if a real attacker, because a real attacker is not going to call you up and say, hey, we're going to think about attacking you. So is there any servers you want us to stay away with, anything that could hurt you guys, anything that's going to kind of get in the way of your day-to-day operations? If so, let us know, and that way when we do break in, we'll kind of work on not letting any of that happen, okay? So incident response planning. This is kind of one of those critical components that you have to have. As we said, it's required by law. It stands for, CSIRP stands for Cybersecurity Incident Response Plan. It is a documented approach to how you will communicate and recover from an attack. These are really critical. I could tell you most of the ones that we see, about 95% of the ones we see, are not right. They are outdated. They don't work very well. Your plan needs to have governance, just like this is different than your policies and procedures, right? You have your policies and procedures for managing your administrative, operational, technical, and physical safeguards across your organization, but you now also need that incident response plan, and that has to have its own governance and its own team and its own approach and its own policies. It has to be, allow for a planned and repeatable response that you know what to do. It's a basic requirement. It's important to have, and we find so many people that don't have them. Make sure it's a professional grade plan that takes into account the current threat landscape. Again, that word again of knowing your current threats. Lastly, test the plan. Make sure that you're testing it and understanding if it works or doesn't work under a real world situation. So in closing, there's a few things I want to kind of let you know. HIPAA and information security are not just IT issues. They involve the entire organization, and you can see it's extremely comprehensive. There's pieces in here on executive intimacy. Your executives must understand, it's a requirement that they understand what's the policies and procedures and that they've signed off on them, and not just signed off, but they've actually read them. And again, think about being deposed. If your CEO got up and we started asking, what's this, that, or the other thing, they should have a familiarity with that plan and an understanding of why security is doing what it's doing and why the privacy policies in your organization work the way they do. I'm not going to go through each one of these for you. We've taken a lot of time on this presentation. The last thing is I would tell you, kind of make sure that when people say, oh, we've got that taken care of, but don't worry about that, that's when you should really start thinking even harder about why does it seem so kind of, nice and neat. You know, one thing I tell people often is if you're really confident about your privacy and security processes, procedures, plans, practices, what we would consider your TTP, your tactics, techniques, and procedures, is then you should be able to turn to anybody and say, you know what, go ahead, try to break in, do whatever you want, no rules, go for it. I have yet to find anybody willing to put that challenge out there. And if you're not, that's probably a good thing, but it also should tell you that you have more work to do. So this is a never-ending process. This is not going to be that you develop some policies and then you're done with it. And you're like, thank gosh. Or that you deploy some security infrastructure or some technical infrastructure and you're done. This is ongoing, and it's meant to be. And that's why the governance piece is so, so important. So I'm really hopeful that this entire presentation has kind of taken a very inside-out, outside-in approach, kind of a more in-your-face approach, if nothing else. A little bit more about us. We do a lot of the stuff, and we don't do a lot of stuff when it comes to what we just talked about. What we do is we do incident response planning. We'll talk more about that. We do pen testing and vulnerability assessments. We have a cyber range. We do a lot around medical device security. We have a security operations center, and we have software that we provide. But there's a couple things I want to talk to you about. If you could just kind of humor me for a few minutes, I want to tell you a little bit about NIST 853 and something we found that I think is really important to understand. NIST 853 has about 677 controls, give or take. And typically when you do a NIST 853 assessment, you're going to find that there's about 1,400, if not more, recommendations that come out of it. And they could be good, bad, or indifferent, which leads to hundreds of remediation projects. Now, the problem with this is that most organizations, small or large or very large, typically cannot remediate everything. And what's more interesting to us is we often will find that organizations will tell us, yeah, we knew we weren't going to do very well. We knew that we weren't going to get through this assessment. So we stopped doing full 853 assessments. We actually have partners that are really, really great at it. But we believe NIST 853, or any assessment that you get to, should be an evolution. It should be more of a crawl, walk, run. And so, you know, we kind of set up this thing called the Sensato Rapid Assessment, which is for those organizations that know, hey, I'm not going to get through this entire 853. I'm not going to get there. I need, you know, we're too immature. We don't have the processes. We don't have the policies. We don't have this. We don't have that. And you're going to spend a lot of money on doing a full 853 and then all the remediation. And the interesting part is you got to do them every year. And every year you're going to just be trying to catch up, and it just doesn't, it's not a good way to do it, we don't think. So what we do have, and if you're interested, we'd love to talk to you about it, is the Sensato Rapid Assessment Program, or what we call RAP. And it is based on 853. It is crosswalk to HIPAA. It basically looks at 10 different areas. And what it does is cover about 80% of what you need to do, but in a much more controlled and a greater time to value kind of approach, right? So what we do is we're able to kind of very quickly ascertain where you are, sometimes within days or weeks, and then give you a very prescriptive approach to how you can remediate those things in a way that fits your organization's complexity and capabilities, more importantly. The cool part about this is that it does meet the requirements for HIPAA in terms of doing an assessment. And so, and the other part that's probably pretty cool for everybody is that it's a much more economically viable program than doing the full 853. Now, the goal is, though, to get you to eventually be able to do a full 853, to actually go out and position yourself that when you go do that 853, you're going to meet most of the requirements and not end up with hundreds of remediation programs. Okay, so think about the rapid assessment program as kind of a precursor to full 853 that lets you prepare for it, right? It's kind of like back in high school when we all did the SAT prep classes. That's what this is, right? And then you can go take your SATs. And so typically you're going to do the Sensato RAP this year or in the year you're in, get through it, remediate, do the things we prescribe to you, and then the next year go ahead and do the full 853, and you will be in a much better position than just trying to tackle it, even knowing that you probably wouldn't have gotten through it. And the same thing applies to things like high trust and other regulations. The RAP program is meant to kind of get you directionally ready to build that foundation, if you will. the 10 areas that we look at are you know, across the spectrum of everything you're expected to have in place. So it's not watered down by any means. We just have a very unique approach that accelerates what we do. And we also have a whole set of tools and policies and procedures that we can give you to help you if you don't have those things in place, or to modernize them. So if you have policies that haven't been touched in 3 or 4 years, we've got templates and other things that can work on your behalf to help you quickly get up to speed. And we can, you know, we can talk more about it with you. Love to talk to you about it. It's a really cool program. For everybody that we've put through it, they've been really excited and positive in terms of the feedback we've gotten on it. So I implore you to kind of reach out to us and talk about that. The other thing that we'd love to bring to your attention is that we do a tremendous amount of great work when it comes to penetration testing. We do all of the different types of pen testing that you should be doing. We can combine them. We're really, really good at what we do. Our company's background is in being attackers, but we also offer a lot more services besides these advisory services. But I did want to kind of raise them out to you. We have a very different approach to pen testing. We spend a lot of time with intelligence gathering. We kind of look at this from a, have you already been breached? Is there something that's already occurred with you? It is an educational process. Our goal here is to help you learn where your gaps are and help you evolve. So coming out of these pen tests that we do, we always kind of try to be very prescriptive around, these are things you should think about, do. Here's the priority around them. Here's why you want to do them. Spend a lot of time with knowledge transfer to your teams. We're not looking at this from a, hey, we got you, we broke in. That's not what we want to do. We really want to be a partner and collaborate with you and use the information that we find to help you kind of evolve your position. So we'd love for you to give us a chance on the pen testing and talk more about that. You know, the other thing is last thing I'll talk to you about is we do incident planning. And again, we're vastly different as a cybersecurity firm, and maybe you've heard, you know, realized that as you listen to me speak to you today. You know, we have a very cool platform called TERP, which is the Tactical Incident Response Platform. It's actually based, and the information there comes from trauma surgery and military special operations. So we employ protocols, standing orders, immediate action drills. You know, honestly, the stuff in this program is not things you're going to hear about anywhere else. I doubt there's anyone else in the world who's talking about the application of trauma medicine and how they deal with triage and escalation and standing orders, or how, you know, we've examined how Navy SEALs and special operation teams actually respond to something like an ambush, and that's where these immediate action drills come from. So it's vastly different. It's very modern. It's meant to evolve and be dynamic. It's meant to deal with that current threat landscape. So again, if you don't have an incident response plan, we would love to talk to you about what we're doing. We can do this as a 5-day class where we can teach you and you can go out and do it in your organization, or we can customize it and kind of be there with you every step of the way. And again, we've got protocols and templates and all kinds of stuff. And we include tabletop simulations so that as the plan's being developed, we can actually test it and make sure it's going to work for your organization. And I would bet you that in and of itself is vastly different than probably anything you've seen around incident response planning. So again, we'd love for you to reach out to us on that. And we can't do everything ourselves. We don't know everything ourselves. We got 2 amazing partners that I want to talk to you about. One is Comply Assistant. That's their URL. They have an amazing a set of amazing services and products. One is their software that they developed that helps you manage the NIST 853 process, as well as our rapid assessment program. But they also have kind of an outsourced service, or managed service rather, around managing your business associates. If you're thinking like, well, how am I going to ever get out to all these business associates? How am I going to check to see where they're at if they're maintaining the same level of security as I am? Comply Assistant's got an amazingly cool program and product that they can help you do that. And from what I understand, it's extremely affordable. So, you know, reach out to them and see if they can help you with that. And if you are ready to do a full NIST 853, we don't do those, right? But we've got Benediaio Group, which is, you know, really great at that. And these guys really get it. They understand it from the bottom up. They can take you to far beyond 853. They're really strong at what they do. You know, so I would also tell you, visit their website, check out what they're doing. You know, I can't say enough about either one of our partners. We don't get anything in return. I want to be really transparent. If you sign a contract with them, we don't care if you ever mention us. We'd love for you, just so they know that we are giving them props. But more importantly, you know, we're not in a revenue share with them. We honestly feel they do great work. So We're just hopefully saving you some of the diligence that you would normally do. So with that, I know this has been a really long presentation. I hope you paused it, got yourself something to eat and snack on. You took a lot of notes, that you'll replay this, share it with others. Look, I used a very assertive, kind of different approach to this because I think for far too long, we've had so much confusion over HIPAA and what should be there and shouldn't be there, and what should an assessment do, and what should policies do, and what's this mean, and what's optional versus not, and how do I know what reasonable is. And so I wanted to kind of cut through that all. And, look, I really hope you got value out of this. I certainly would love to hear from you. If there's anything we can do for you in terms of cybersecurity and any of the myriad of things that we do, or even if it's something we don't do and you just want to talk and reach out and say, hey, I just got a question, you can reach out to us at info@sensato.co. We firmly believe that not everything is about money and not everything should be a statement of work. So you got a question, you want to share something, please let us know. One of the things I often talk to people about is attackers collaborate, right? They all get together. If I needed to break into something today that I didn't know how to break into, I can put out an email, a message, and I can have 5 or 6 people across the world who will say, hey, we'll help you, or we've written this malware, or what's it about, or let me see what I can find. On the defense side, we don't really have that. So I'm really hoping that forums like this get us to start talking and collaborating, right? So I'm telling you that because, again, we don't believe everything has to be a contract. Everything doesn't end up with a $sign. If we can help you and we can share some information with you that makes your life a little easier and helps you secure, your environment a little better, then we're fulfilling our mission. And we're very passionate about our mission. So please reach out, get to know us. We'll do all we can to help you. All right? Hope this was informative. Take away a lot of valuable information from it, I'm hopeful. Thank you.